and survivors. I'll try one more time. Everyone, welcome to the Wellness, Resilience, and Survivorship seminar series. This is our chance to take topics that we believe are important to our wellness and to cancer survivorship, and to take a deeper dive in a way that we may not have an opportunity to do so in the clinical setting, or at least in our normal clinical visits. And today, as always, I believe we really have a really stellar and valuable panel. And I'm going to take a moment and introduce our panelists, and we'll get started in a few moments. So thank you again for joining. I'm going to start by introducing May Murakami, who is a native Angelino, I learned. She has a doctorate of physical therapy locally from CSUN, and she's one of our physical therapists here at Cedars Sinai Medical Center. She does specialize in lymphedema, in cancer rehabilitation, and pelvic floor dysfunction rehabilitation. I also learned that her fun fact is that she loves hiking and paddleboarding.
Yeah.
So May, thank you so much for joining, and she'll start momentarily. I also want to introduce someone that I believe probably most of you know. Allison is a certified yoga therapist, and she's been accredited through the International Association of Yoga Therapists. And she's been working with people living with cancer since 2007. So really quite a long time. She has been affiliated with us at the Cedars Sinai Cancer for, I think, at least 12 years. And she's really played a really invaluable role in supporting our cancer wellness program. So thank you both so much. I want to just emphasize that we will save the bulk of the questions to the end. So please do feel free to convey any questions and comments through the chat or the Q&A, and I'll help moderate, and I'll be in the background. We're going to start with May. Again, thank you so much, and I'll hand it over to you. Thank you.
Great. Thank you for having me, Dr. Asher, and welcome to everybody out there. So again, as he stated, I do specialize in oncology rehab and lymphedema as well. So I'm happy to be presenting kind of a Lymphedema 101. This is a pretty basic presentation, but hopefully it gives you some insight into what's going on with lymphedema. So I'm just going to share my screen really quickly so that we can see the PowerPoint. And we'll view this slow from the beginning slideshow. Okay, so again, welcome to Lymphedema, an overview and support. Again, I'm going to do the lecture part of it, and then Allison will take us through some great movements that can be helpful to the lymphatic system, with or without lymphedema. Again, as the disclaimer already said, you can read it again if you didn't read it the first time. I have no disclosures for this presentation. Okay, so our objectives for this presentation, we are going to talk about what is lymphedema and how does it happen, stages of lymphedema, risk reduction practices, treatment options, and then available resources. First, though, of course, we kind of have to know what we're talking about. So the lymphatic system is pretty amazing. It often kind of gets unrecognized versus the circulatory system, but we have about 600 to 700 lymph nodes in our body. The majority are located in the abdomen, although this picture doesn't do the greatest job of showing it. And then we also have a lot in our head, in our neck, our axilla, which is also our armpit region, and the inguinal or groin region. The function of the lymphatic system is there's many roles of it, but it does collect and return protein and water from the interstitium to the cardiovascular system. And the interstitium is kind of like, you have to think of it as the glue that kind of holds our whole body together. So all of our cells and everything are within this thing called the interstitium. It also can hold water in here too. So it's really interesting that it can hold about 30% an increase in water before we even see visible swelling. The job of the lymphatic system is also to absorb protein, fat, and fat-soluble vitamins through the digestive tract, because again, remember, majority is located in the abdomen. And it also serves an immunological function where it recognizes and responds to foreign cells, microbes, and cancer cells. I love this picture because it just kind of shows like a lymph node in itself and kind of how it relates to the circulatory system. But lymph fluid is very different than other swelling in that it's made up of protein, and then it also carries other cells in it, like red blood cells and white blood cells and cancer cells. And also, of course, it's because it's collecting the waste products. We see that with other foreign substances and, of course, the fat from the digestive system. When we talk about lymphedema, what we are talking about, this is the actual definition of it, is that lymphedema now is an abnormal accumulation of protein-rich fluid in the interstitium, so again, in that cellular space, which causes chronic inflammation, fibrosis, or also known as hardening of the tissue, and varying amounts of fatty tissue proliferation of the affected area. That's a mouthful just to say that there's fat collecting there too. I do love this picture of like a jello. So again, if you think of a jello mold, all of the strawberries and the fruits in here are the cells of our body, and that interstitium is kind of the jello surrounding it. And that's where the fluid is collecting. There are different types of lymphedema. So there's primary lymphedema and secondary lymphedema. Primary is more so something where there was a dysfunction with the lymphatic system to begin with. So these are people who are either born with less lymph nodes or the lymph system's not working perfectly. It can be hereditary or sporadic, meaning that there may not be a family history. There is also secondary lymphedema, which is more what causes lymphedema in the US. So this is caused by cancer, predominantly breast cancer, because of disruption to the lymph nodes. But other health conditions can also affect this, including lipedema, chronic venous insufficiency, and other damage to the lymphatic system. Again, most of the research on lymphedema is done on breast cancer. So we know the risk factors for breast cancer-related lymphedema. And then we do just kind of generalize this to other lymphedema as well. But what we know is that the amount of lymph nodes removed, having radiation, or having obesity, which is a body mass index greater than 30, can all contribute to getting lymphedema after breast cancer. So I often get asked this question in my practice, which is why I wanted to bring it up, and not more so as like a scary factor, but people often ask, how does lymphedema occur, or are afraid that because they have lymphedema on one side of their body, that they're going to be getting it now everywhere or on the other side of the body as well. Again, it really just occurs where damage to the lymphatic system was. So if you had lymph nodes removed only on your right arm, you're not going to be getting the lymphedema on the left arm. So again, a lot of people are fearful of that. So I just kind of wanted to keep this slide here. So again, basically anywhere there was disruption to the lymphatic system is where it can occur. And again, I often get asked, well, why can't they just suction out this fluid, or will it go away? So we see that a lot. And I did want to point out there is a difference. So a lot of people understand the term edema, and I wanted to show how it was different than lymphedema. So with edema, that may happen when you have like a swollen ankle and your ankle swells up. That is edema. So it's a symptom of an injury that happened. Again, it can be generalized or local. So again, you can have swelling everywhere or just in that spot that was damaged. This is fluid accumulation, but again, separate than lymph fluid. And it goes away when the underlying issue is treated. So when your ankle heals, or when, again, you have a total knee surgery and that gets better, you don't see the edema anymore. Edema, of course, is normal after swelling, after surgery, or any time, again, there's inflammation in the body. Lymphedema is different. So lymphedema is actually characterized as a disease. It does have its own ICD-10 code. And it's, again, more localized to the area of damage. So again, if you had lymph nodes removed under your right arm, it's not likely that you'll see lymphedema develop in your left leg. Again, it's the high protein fluid, which makes it different. And it can progress. So it doesn't generally go away. There are stages of lymphedema, which we'll talk about. After surgeries, as we said, since it's normal to have some swelling, it's hard to tell before 3 months if this is going to be lymphedema or, again, if it's just normal swelling from the surgery. So how do we diagnose it? Again, there's no necessarily degree of enlargement of the limb or of the trunk where you're having the swelling. Oftentimes in our clinics, so for physical therapy, we start what's called complete decongestive therapy, which is the process of reducing the body part when we see a 10% difference between the limbs. We also look at past medical history, subjective complaints, and again, it needs to be a thorough exam. So there's not necessarily one gold standard in diagnosis. The way we measure, of course, is in a physical therapy clinic, we usually just have a tape measurer. So again, we do the tape measure, we take the volume differentials between both limbs. And like I said, if it's 10% or more, that's what triggers kind of a reduction process or trying to help reduce that limb. There's also something called water displacement, where you stick the limb in water and you see how much the volume rises. That's more used in research-based for lymphedema measurements. And there is a new area called bioimpedance, where basically you get a shock sent through your body, and it helps, it's an electrical current, and it can measure the difference in water and volume between different body compartments. So that's pretty amazing, but it is not available everywhere. As you can imagine, it's pretty expensive. There are other ways that we can now image the lymphatic system, which is also, again, we're living in a time right now where we have so many more tools available than we used to. So I'm really excited about it. But there's something called a lymphoscintigraphy. And this is oftentimes used even in surgeries when they're trying to trace back the sentinel node. So they would put in a radioisotope and they would show kind of the pathway of the lymphatic system. But something that's being used more and more is called near infrared fluorescence lymphatic imaging. And that's what you see in this picture right here. So they inject with something called indocyanine green. The nice thing about it is it's not radioactive, but it can still show the lymphatic vessel architecture and the flow. So you can see in picture A, for example, where the lymphatic system is not moving. That's in the enlarged photo. And that's a better way now to track where there's disruption to the lymphatic system. So again, we talked about how lymphedema is a disease that can progress. There are different stages. So you can see from stage 0 to stage 3. Stage 0 is generally considered latent or subclinical. So we know the lymphatic system may be compromised, but there may not be any symptoms yet. If you remember, that interstitium can hold fluid up to 30% before we even notice swelling. So that would be considered stage 0 if we're not seeing that swelling. There is stage 1, which is early. You may start to notice the swelling now, but it'll reduce overnight. So again, a lot of people are like, well, my hand was swollen, I went to sleep, and then I woke up in the next morning and it wasn't swollen anymore. In stage 2, you're no longer seeing those swelling go down anymore, and you may start to notice the tissue changes as well. And stage 3, or the later stages, is when, again, of course, it's more severe. We see more of that fibrosis buildup and tissue changes, and then the hardened skin as well. So these are risk reduction practices. I always like to caveat this by saying, we don't really know for sure, even if you follow all of the guidelines and do everything, that it can be 100% prevented. But these are the best risk reduction practices that we have out there to help us with this. So of course, you always want to make sure you're getting your medical checkups. You're making sure you're telling your doctor if there are any changes, even achiness. A lot of people don't have pain as their first symptom with lymphedema. A lot of times they have more of like an achiness or a heaviness that they report. Again, maintaining that healthy weight. As we know, BMI greater than 30, more likely to have lymphedema. Making sure that you get exercise, taking good care of your skin. The reason is skin is the biggest organ in our body. It's a great barrier to anything. So this is the way to avoid infection or inflammation. Again, avoiding trauma or anything that could increase swelling of the limb. Avoiding excessive, tight, restrictive clothing or jewelry. Again, the idea being that that can cause a tourniquet effect. And then there is a question mark about compression garments, because this is, do we wear them as preventative care? Do we not wear them? A lot of times it depends on your personal situation. And we'll get into that in a second too. So again, there are some controversies still within the community of when a sleeve should be worn, or are these big risks to the lymphatic system. So with flying, because of the pressure changes, we used to think everybody who's ever had damage to the lymphatic system, whether lymph nodes removed or not, should wear a sleeve. However, more research today has shown that there is little evidence to show that flying can initiate or worsen lymphedema. There was even one study that was done that showed the prophylactic or the sleeve that you wear just in case may actually make swelling worse. So again, this is one area where it's kind of a back and forth and it's kind of personalized to yourself and you need to discuss with your medical provider. Blood pressure cuffs as well. Again, it used to be that you didn't want the blood pressure taken on the side, that the lymph nodes were removed, because again, that can create the tourniquet effect. But this hasn't been shown to be true in studies. But as a just in case, to try to take it on the other arm if possible. And then heat and cold intolerance as well. So also conflicting evidence. There was ideas for the longest time that you shouldn't be submersed in hot water like a sauna or hot tub. And again, the idea being that it raises your body temperature and that overall it can cause swelling. So it may cause more swelling here too. But again, there hasn't been definitive evidence. So you may be thinking that's great for preventative care, but what if you already have lymphedema? So again, what we've talked about, the complete decongestive therapy that is usually done by a physical therapist, but occupational therapists and even massage therapists get licensed in this as well. At Cedars, we do it mainly in the physical therapy department. But this is considered the gold standard of care. So again, anybody who is a certified lymphedema therapist or CLT can do this. It means that we've gotten the training in it. And it usually consists of manual lymphatic drainage, compression, exercise, skincare, and those are the four main tenets, but I put in parentheses self-care and nutrition because we're learning more and more about the importance of that, just like in general for our well-being. So manual lymphatic drainage is a gentle massage, but it's enough to stretch the skin. So if you're just kind of brushing on the surface and not moving the skin, it's not really moving that lymphatic fluid. You don't want to go too hard though either because you don't want to push into the muscles. The lymphatic system is more superficial than that. So we usually do 1 stroke per second because we're mimicking the rhythm of the lymphatic system. And it is done for a specific direction and purpose to move the fluid. The effects, of course, is that it improves the uptake of lymphatic fluid. It increases the contraction of those lymphatic vessels. It has a soothing effect, and it can also help with pain as well. With compression, again, this is it depends on the stage of lymphedema. There is a lot of compression choices out there. So if we need to make the leg or the arm smaller first, we usually use something called compression bandaging or Velcro reduction garments. If you're more in that stage 0 or stage 1, the earlier stages, you may just need like a light compression garment, and know that we have different garments for night and day. So these are examples of the garments worn during that reduction phase. So if we want to make it smaller, we usually use a combination of either short stretch bandages and these newer Velcro garments, which can be nice for some people who just can't tolerate the bandages as well. Again, with the compression garments, there are a lot, many to choose from, especially now we have so many choices. Again, they're measured in millimeters of mercury. So that's how you determine the strength of them. You can get them over the counter, but if you have a limb that is a different size, or again, if you're in those later stages, you may need a custom garment. And again, there are Velcro garments for this stage as well, and they do need to be changed every 6 months. So this is an important part because a lot of times I've seen patients who've done really well, they have their compression garments, they leave to help take care of it on their own. But then when they come back, either the arm or the leg is more swollen again, and it's because the garment hasn't been maintained. So that's a really important part. And again, these are all different types of compression garments that we work with. You can see the more padded ones can be for breast lymphedema. There are people who have like trunk and breast lymphedema, in which case you can wear compression garments on the trunk. And then the nighttime garments you can see are a little bit thicker. They have the padding to help support you at night. Bottom line being that compression, because there are so many choices, it's really an individual decision, best made between you, your certified lymphedema therapist, and often a compression fitter who will come and measure your arm as well. Some insurances cover this and some do not. Medicare does not, unfortunately. However, this is very exciting for me to add this year. In December 23rd of 2022, so pretty recently, the Lymphedema Treatment Act was passed by Congress, meaning that Medicare can supply compression garments through insurance, which is very exciting for us because Medicare has never covered these garments before, and they can get expensive. Because Medicare is just the way the system works, it will not go into effect until January 1st, 2024. But this is very exciting. If you want to learn more, you can go to the lymphedema-treatment-act.org. We're not necessarily sure yet which garments will be covered, if it will be the bandages and sleeves. So we'll keep updating on that. And for people who have had breast cancer and have lymphedema, there was something called the Women's Health and Cancer Right Act of 1998, where technically federal law said that people who have had breast cancer should be covered for anything, including lymphedema supplies. The unfortunate thing is I have not seen this, or I don't know if there's a lot of loopholes, but insurances still will not cover. So I don't know if we need to keep pushing insurances and remind them of this, or if there are ways around it. But if you have breast cancer related lymphedema, you may want to check with your insurance to see if they recognize this. And again, for compression pumps, these are mainly used in the maintenance phase to help take the place of manual lymphatic drainage, or they can again help just decongest the legs or the arms. You still want to practice all the other parts of lymphedema care, so compression, exercise, skincare, and manual lymphatic drainage. And there is a new one called the Koya Day Spring. Most of them were vasopneumatic, so you can see where the guy is resting and it's attached to tubes. This new one is powered by lithium batteries, so again, you have more mobility with it as well. Know that these compression pumps actually may be covered by insurance, even if the compression sleeves are not. And then finally, skincare, of course, to reduce the risk of infection or inflammation, wearing sunscreen, insect repellent. A lot of my patients like to garden. So if you're working with sharp rose thorns or anything like that, make sure that you're protected there as well. And then finally, exercise. So a lot of people who have had, in the past, it used to be, don't lift your arm, don't lift anything greater than 5 pounds. We now know there are actually numerous studies done on exercise for lymphedema. Again, most on breast cancer, but it is shown that not only is it safe to exercise with lymphedema, but it's even good preventatively as well. What types of exercise are good? Really, anything that you like to do, as long as you've been cleared for your doctor. The only thing we suggest is that you build up slowly to not overload your system, just like anything else. We try to not have an injury happen. Usually right after surgery, again, you'll have restrictions. So that's where you want to ask your doctor when it's safe. Again, these are great examples of the types of exercise. So weight training is really good. It was even shown that it can have a protective role in development of breast cancer related lymphedema. Cardio, of course, just like anything else, running, walking, you want your 150 minutes to moderate to high intensity exercise, or 75 minutes of vigorous intensity exercise. Pilates and yoga, which are near and dear to mine, and I'm actually Pilates certified as well, and yoga, or Allison is yoga certified, so we like these. There's a lot of breathing exercises involved, so it helps return with the lymphatic pump. It helps with range of motion. And aquatic therapy is really great because being submerged in water, that hydrostatic pressure adds as compression. So a lot of people who have like breast and truncal lymphedema, where it doesn't have the best compression garments, can do this and they feel a lot better. Nutrition, I'm going to talk about in brief just because I am not a dietitian or nutritionist. So I really recommend working with someone like that. But there are two main emerging camps that are coming out for lymphedema. One is whole foods, or more of an anti-inflammatory diet. And you can see that book on the top was written by some of the best lymphedema doctors. And then a ketogenic diet as well has been shown to help with lymphatic disorders, including lymphedema and lipedema. Like I said, please talk to your healthcare provider about this. There's not much that I can say on that. Finally, there are surgical interventions as well. So these are also relatively new in the care of lymphedema compared to complete decongestive therapy, but have amazing results so far. So there's something called the lymphovenous bypass, and that's that first picture here. It's basically where the lymphatic vessel, so again, they'll use that ICG and they'll see where the lymphatic vessel is being blocked, and then they can reroute to the venous system there, and so that the fluid flows that way. There's also something called the lymph node transplant, where they can take healthy lymph nodes from another part of the body to help the affected area. And then oftentimes liposuction is done with this as well. And it's not necessarily liposuction to lose weight, but again, because of the fatty tissue buildup and that hardened tissue, it's needed to help remove all of that to give the lymphatic system a chance. At Cedars, we have two great lymphedema surgeons. So we have Dr. Brazio and Dr. Patel who perform these surgeries. And then, of course, we have our lymphedema therapists like me in physical therapy who help both before and after the surgery, or even without the surgery if we need to reduce, or again, if you're just coming in after breast cancer treatment and need help with range of motion, we can help with all of that as well. And then here are my references. So thank you.
Hey, thank you so much. At this point, I'm going to hand things over to Allison, and she's going to share some insights on how yoga and yoga poses and breathing exercises might be useful for the lymphedema. So Allison, all yours. Thank you.
Wonderful. Thank you so much. So I've been working with many women over the years who have worked with their lymphedema. And I have found that yoga, therapy, and some of these exercises that I'm going to share today are really helpful. And people feel better after this, after a good yoga class with some of these exercises. So here we go. And slideshow, whoops. Sorry, I'm trying to get the slide. There it is. Okay, great. So thank you, May. I always learn so much from you every time you do this. I know we've discussed it, but it's always so nice to hear this again and again. It really bolsters my work. Yoga therapy, or yoga, is a great form of exercise for those experiencing lymphedema because it can be easily adapted to fit the abilities and limitations of the individual who is exercising. And that's Joachim Zuther, who's the founding member of North American Lymphedema Education Association. So this is really where I start with everyone. Our bodies are different. The lymphedema is different in different bodies, different places, different levels, different stages. So it's really important to listen to your body and move safely, you know, for your body and what's happening with your lymphedema. Yoga therapy general guidelines. Always, as May said, follow the directions from your ND, PT, and your lymphedema specialist. Lymph circulation is improved with muscular movement, okay? But we want to avoid pushing or forcing any movement beyond what's comfortable for you and never moving into pain from a yoga therapy perspective. We can move into poses, finding the edges of stretches. Many of you who've studied yoga know that we don't push into a stretch too deeply. We find that edge of the stretch where we just begin to feel it. And maybe we take a few breaths there before moving deeper. And this gradually allows the body to move. Time and consistent practice will begin to increase your flexibility and your strength. And here's the big one, breath. Breath and awareness help to keep us present, mindful, and focused as we move in yoga therapy. Jon Kabat-Zinn, founder of MBSR, Mindfulness-Based Stress Reduction, says, the definition of MBSR, mindfulness, is the awareness that arises from paying attention on purpose to the present moment and non-judgmentally. So some of this work is really meditative. You know, we're just paying attention to what we're doing on purpose. And that really helps us from overdoing anything, right? Our bodies are different. We honor where we are. Yoga meets us where we are. We don't have to fit ourselves into a pose. The yoga comes to us. That's our philosophy. So the first exercise we're going to be doing is belly breathing. Deep abdominal breathing. And this is how this sort of helps everything. I'm just going to move this over a little bit. Good. So deep belly breathing helps the flow of lymph fluid move through the body, right? It allows lymph to flow into the lymph system, into the chest, and away from the extremities. We want to get it away from the extremities and bring it into the body so it can move through. Changes It changes the pressure in the chest and the abdomen, helping to move lymph flow back into the blood system. It's useful for upper and lower body lymphedema and head and neck swelling. All of this work we're going to do in the next few minutes addresses all of those. And from a yoga therapy perspective, again, it supports the parasympathetic nervous system, right? It just calms us down, which calms the body down, which helps us to feel better. We know that when we're in fight, flight, or freeze, it's sort of like pressing on the gas pedal of the nervous system. We get ramped up, our heart rate goes up, we may get sweaty palms, we get anxiety. This kind of work is like pumping the brakes. We're sort of pumping the brakes on the parasympathetic and relaxed and breathing when we move through all of these postures. Perfect. So I'm going to show you these slides quickly, and then I'm going to demonstrate them, but everybody will have these to refer to. We'll practice the belly breathing, and then we're going to move into some pelvic tilts. I'm going to talk through all of this, and we'll work through all of this together. And then we're going to do some dynamic hamstring stretches. You can do this with or without a chair. It's sort of nice to do with a chair. Again, we're sort of pumping the muscles. We're moving the muscles to get the lymph flowing. This is good, particularly good for lower body lymphedema, this one. And then we'll move into upper body. So we can do some finger slides. Some of you may be very familiar with this in PT. And then from a yoga perspective, we'll use a yoga prop. If you don't have a belt today, don't worry, you can watch, or you could use, a bathrobe tie or a leather belt, or even holding a dish towel gently, if that feels okay on your fingers. You can work this one. This is also weight bearing. And I call these angel arms, opening and closing. We'll work on those with the breath. And then at the end, May had put together this great little healthy habits for patients. And if we have time, maybe we can do a little bit of that. So I'm going to leave the screen on, let's leave it on the belly breathing for now. Okay. This is where we shall start. So if you'd like to join, come on down. If you would just rather watch, that's absolutely fine too. I have my mat set up here. It's nice. I like to put a blanket down on my mat. Anyone who has, if the floor is too hard or your floor is not carpeted, maybe you have a little osteopenia, osteoporosis, it's nice to have a little cushion. You can also do this in bed in the morning. You can do this in bed when you wake up. It's sort of a nice way to wake up the body, get things moving. So I'm going to take one of my blocks so you can see a little bit better. Hopefully you can. So we'll start with the belly breathing. Always have a little something under your head and neck, right? In yoga therapy, what we're always trying to avoid is, for instance, I'm going to exaggerate, but this position. When your neck is in this position, you can bring your hand onto your chin, your hand onto your forehead. When the chin hand is higher than the forehead hand, you need a little something under your head just to keep your neck in a nice, safe position. It's nice to keep the shoulders off the support, right? Letting gravity do the work and open up the chest a little bit. So you can take your hands or a block right on your belly, right around your navel, whatever works. Close the eyes is nice if you'd like. If you'd like to relax your legs, you can walk your feet apart and let your knees fall together gently. So what we're going to try to accomplish here is really working the belly, really getting things moving by moving the diaphragm. It's tempting to want to sort of blow up the chest and the rib cage here, but the way I like to visualize it is though your belly is like a balloon, and we're going to inflate it so the block rises, and then we're going to deflate it so the block sinks down. But we always start with a few normal breaths. So just taking a few nice, easy breaths here, feeling the back of your body relaxing and softening into the mat. It's important to get a little grounded here. And then with the belly, we're going to inhale through the nose if you can. Blow up the block or your hands. On the exhale, let it sink down. Inhale, blow up the belly. Exhale, let it sink down. One more. Inhale, blow up the belly. Exhale, let it sink down. You can do one set and then you'll take a few normal breaths. So it's always important to take breaks. If you want to do another set of 3, you can, and then take a break. And then a third set if you'd like of 3. But I recommend no more than 3 sets, 3 sets of 3. Block to the side. Another way to move lymph is through pelvic tilt. This is nice for lymphedema in the trunk, the hips. This is a nice way to move it. You can open your arms comfortably out to the sides. And we're going to think about the belly. We're going to think about the breath here, just as we did in the belly breathing. Inhale, imagine blowing up your belly like a balloon through the nose if you can. Exhale, pull the belly down and gently tuck your pelvis under. You can press into your feet a little bit if that feels okay. Inhale, blowing up the belly, bringing the pelvis back to neutral. Exhale, pulling the belly down and gently tucking the pelvis under. Let's do one more. Inhale, blowing the belly up through the nose. Exhale, pull the belly down gently and tuck the pelvis under. And then come back to neutral. Always take breaks, always take a few breaths, to take a few breaks. And then we're going to bring our toes onto the chair. Now, I like to use a chair just because it sort of sets where my low back is. We want to make sure you feel the tailbone on the floor. So the chair isn't too close into you, that you feel that the knees are on top of you, but you also don't want it too far away that you feel like you're arching your back and straining your back. So it's right in the middle, feeling your low back restfully on your mat, tips of the toes on the chair. And normal breathing here. You can just breathe normally here. We've done some good breath work. So you stretch the right leg up, flex the foot to the edge of the stretch, just so you feel a little stretch in the back of the leg. And then you switch. It's just upside down, slow motion running, right? With a flex foot. You can put your toe, just rest your toe gently on the edge of the chair each time. And that also helps to work the low belly a little bit. So this is a nice little bit of core work as well. And again, nice and slow and easy, normal breathing, flexing. We get to open up the hamstrings. Nice, easy breathing through the nose. And you can do this for a minute or so, whatever feels comfortable. And then coming on down, bring your feet onto the floor. Take a breath, let your low back settle in. We always build in pauses in our yoga practice. If we can learn to build in a pause or two in our yoga practice, the hope is that we can learn to build a pause or two into our day, right? Taking a little time out. To come up, roll to the side that is not, so if you have lymphedema in your right arm, roll to your left side. Roll away from the affected arm is what we do. And then you'll come on up. And then for upper body, we'll do our finger slides. So I'm going to just move the chair away and adjust my camera if I need to here. And you can take your blanket away. Here we go. And I'm going to adjust this a little bit. I might stand off the mat on the floor. So you can do these to the front or to the side, right? So I like to stand with my feet hips distance apart, about a foot, foot and a half away from the wall to start with. Again, this depends where you are, where your range of motion is. As your range of motion begins to grow, the closer you can get into the wall, okay? So you just do a little fingertip up the wall. And when you feel that edge of the stretch, you can take a breath or two there and slide it down. Now, if you're further along, I always do it to both sides too, because sometimes the arm that isn't affected is overdoing things. So it's always nice to stretch out that arm and shoulder, right? So as your range of motion grows, you can come a little closer in and slowly walk your fingers up a little more. You can also do this one to the side. Again, the further away you are, that's where you start. And then as you get more range of motion, you can come closer into the wall to stretch the arm up fully. Other thing with the belt here, this is a great belt. A lot of my students have it now. It's a great thing to have. It has loops in it. It's an exercise belt, but it's great because everybody has different range of motion for their arms and shoulders. So you can put your fingers, your hands through the loop up to your wrists. You can also use a regular yoga belt and make a loop. You can take an exercise band, but you want to hold gently with your hands. And with the breath again, the breath tells us where we are. The breath allows us not to overdo it. When we start getting out of breath or we're paying attention to the breath, we're often paying attention to the body, right? So we don't overdo it. So nice and easy here. Feet hips distance. Inhale to the shoulders, a little tension in the belt. Exhale down, keeping the chest lifted. Now you may be starting lower. You may be starting here. Inhale just a little bit and exhale down. As you get more range of motion, you inhale up a little higher and exhale down. Inhale opens and exhale closes in yoga. Inhale expands and exhale brings everything back down to center. And you can do 3 sets of 3 or 4, whatever feels good. And it's really nice. The belt sort of stabilizes your shoulders here. It also gives a nice stretch to the spine. So this is a really nice one to do. If you have issues with balance, you can do it seated. And you can also do it with your back against the wall. It's nice to do it with your back against the wall. That's a nice way to do it as well. And then the last thing I'll show you, angel arms. This really opens up the chest. I often teach this seated so you can really focus on the arms. It's nice to sit at the very hip of the chair. So sideways. I'm not sitting back in the chair because we want to strengthen the spine. We want to sit nice and tall. So it's nice to sit up. And then you bring your palms together, feet or hips distance. You can keep your elbows low to start with. Again, we work with what is happening in our bodies, right? Never overdoing. So you can start here. Inhale, open. Exhale, close. Inhale, open. Exhale, close. As your range of motion increases, you lift the elbows a little higher. And we come to here. Inhale, open. Exhale, close. The breath keeps us mindful. It keeps us paying attention to what we're doing in this moment. And again, you can do 3 sets of 3 is usually the best, safest way to go. You can do a few more. You can do a little bit less. But those are some yoga therapy techniques for lower lymphedema, trunk lymphedema, upper body lymphedema. Thank you.
Allison, thank you so much. And at this point, I would love to entertain any questions from the audience. While I have the moment, maybe I'll start. And May, I'm going to pick on you first. You know, you mentioned during your talk, and I apologize to back my ambulance for a moment. you mentioned in your talk that there are, of course, certified lymphedema therapists that are often, but not always, physical therapists or occupational therapists. Many patients ask us about lymphatic massage therapists that aren't necessarily certified, but they've gone through PT for a while, and they ask if they should continue with a lymphatic massage therapist in the community. There are many of them out there. What are your thoughts?
That is such a great question, because yes, lymphatic massage or lymphatic drainage has become such a hot buzzword in today's society. Everybody is getting it for any reason whatsoever. And the idea is, again, while it can help with the lymphatic system increasing, as you saw, like the flow of it for a little while, the effects are usually temporary. So the way that other people are using it is really interesting. Again, if you have a good working lymphatic system, it's usually doing that job. That being said, if you have lymphedema and you do want to continue on, I think getting lymphatic drainage is good as long as the person has worked with people who have had cancer before or who have gone through treatment and understand lymphedema. There are massage therapists who can be CLTs as well. So if you can go to a massage therapist who has that CLT, that means they've taken the same programs that we have to understand the correct drainage pathways versus regular lymphatic massage, where it's just an overall drainage to the whole body. So there is a difference, or things that need to be watched out for when somebody has lymphedema as well. But yeah, there are several in the community who, again, if you can work with them and they understand what you're saying. If you have lymphedema, that's great. I've actually tried to send my patients to some people who are considered lymphatic therapists. And I've had someone who is told that they shouldn't be getting lymphatic massage because they don't have lymph nodes, when it's the exact opposite, like that can actually help them. And someone else who also said that like lymphatic massage shouldn't be. So again, you want to make sure you're going to somebody who's reputable, is basically the end of that. But yeah, there are people out there who can do it other than the physical therapists and OTs if you want to continue on with your care.
Thanks so much. I'm going to take advantage of this moment. Maybe this one's for Allison or May. As you both are aware, many of our patients have told us that the lymphedema may cause psychological distress, right? We've been focusing on the physical piece, but either as a reminder of their medical experience or perhaps contributing to body image changes. How would you guide that person who might have these concerns?
Do you want to take it away? Yes. So there's a wonderful quote by a Tibetan Buddhist monk who actually recently passed away, Thich Nhat Hanh, and he says the best way to take care of the future is to take care of today, now. So that's a big philosophy in our yoga classes. We can't get into the future and the past is behind us, right? And that's what causes mental suffering, living in the what ifs of the future and the should have, would have, could haves in the past. We talk a lot about how there's a wonderful myth, a Hindu goddess named Akhilandeshwari, and she is the goddess of never not broken. So two negatives make a positive. So she is the goddess of always broken. And there are beautiful depictions of her, and she's opening up to the world, and she has sort of cracks and different pieces coming out of her body, but through those cracks shines this beautiful light. And so we talk a lot about how we are more beautiful in our quote unquote broken places, right? That is where our wisdom, our compassion come from, our kindness. It's a beautiful story. I share it, usually a couple times a month in classes. I even have people who have, it's meant so much to them that they have Akhilandeshwari tattoos. They get tattoos on their bodies just to remind them that, and we're all broken, right? We all have issues in our lives, and that's really what makes us beautiful and kind and wise. So that's sort of how I approach it.
Beautifully said.
Yeah, I love that. I don't think I could improve on that. That was great.
Maybe unless you have other comments, maybe I'll close on one more question. And again, I'm bringing up the things that I'm thinking about it occasionally. As you're probably aware, and this may be more for me, but I'll open it to both of you. Photobiomodulation, or otherwise known as laser therapy or red light therapy,
Yes.
is being at least reported to have maybe some benefits for lymphedema, and this is an emerging area. Who should explore, because now you can get handheld devices for, for purchase on Amazon or Walmart. Who should consider these devices, and do you have any experience with the use of photobiomodulation for lymphedema?
Yeah, it's again a really interesting where things are always changing, because in the past when we've used red light therapy a lot in physical therapy, and it has such good benefits behind it. There's a lot of good research behind it, but they always said not to do it on people who've had cancer, because again, the idea is that since it speeds up cellular processes and helps with healing, but it can also speed up cancer cells. And then they started using it for actually helping people who have cancer as well. And there have been some studies, again, smaller studies, but that it does help to reduce lymphedema. Again, it's a hard one in terms of like using it at home. The lasers that they use in the treatment for research are not necessarily the same as that you can buy on Walmart or Amazon. So I would just be wary of that. There were medical companies that were making home lasers. I don't think they are as much anymore. So I would myself need to go a little bit more into research on what lasers are out there for home use, because the company that I used to go to is no longer giving them out, and that would be a reputable one that I would trust. Certain physical therapy offices do use the laser, and those are the same ones that are used in research. So I would probably start there and see if that improved. Like again, if somebody had lymphedema, they could do that. It also is good for like scar tissue and fibrosis. So again, you can use it on those areas as well. Not just for people with lymphedema, but really any ortho injury too. So yeah, it just depends. But I would maybe start with your therapist in the clinic, see if it even worked for you or how you liked it before maybe going on to like a home purchase.
Oh, you answered all my questions. I guess at this point, I want to thank our audience, whether you're watching this recorded or if you're here with us right now, for taking the time and of course, I want to send a big thank you to Allison and May for helping us support all our patients and taking the time this afternoon. Thank you both so much, and to the group, thank you for all your support. I want to also thank our administrative team in the background for helping to organize all the logistics. Hope you have a wonderful night. Thank you, everyone.
Thanks, guys.